So let's talk about partners who do so well, like providers and insurance companies. So if we look at the model from a standpoint of commercial insurers, you would think that what was just described by Ted would be the perfect intro to, okay, guys, you've had a chance to watch the experiment, and how are you going to do it? So what are we seeing anything that gives us an idea? There was, Humana just today announced, what was it, instead of the Oncology Care Model, the Oncology Model for Care?
Right.
Right?
Right.
Yeah, so
right.
creative.
Right, exactly. Yeah, we are seeing it, but I still think that they are taking just pieces of things and then saying, well, here's like something that's a little bit easier to kind of bite off. And that's largely a reflection of the fact that, Medicare does have the largest kind of share of patients in terms of volume of cancer. Right. So when you're in different markets, whether you're Humana or Aetna or Cigna or a local Blues, you'll never have that volume. You just won't, like statistically.
I know.
So
I don't understand how an Aetna,
can make that work.
Can make that work, right?
Exactly.
In most markets, you're a single-digit %
Correct.
in terms of the penetration.
And at best, maybe double, but like low
right.
doubles. So anyway, so I do think people are doing that, but they're not doing what we've described. And however, I would say that what's interesting about kind of this 2.0 conversation has been the most interesting uptake has been employers. And so now there is this conversation at large Fortune 500 workplaces about we have employees with cancer. We do not hear that they're getting the kind of care that they want. So we are going to now try to drive that conversation more directly.
You have what, Pitney Bowes and Eli Lilly, but there have been just a handful of employers.
I think that's
that really have stepped in over
but
the years.
There's
but
more.
now you've got the National Business Group on Health.
Yes.
You have literally Midwest Business Group on Health. You have state business groups on health that actually represent. There's a really novel program going down now in Florida Cancer Specialists and some of the employers down there called Florida Connections. And so you see these offshoots, and I think to dovetail what Kavita said, and let me make it clear about this, we're actually looking at this OCM 2.0 not as a Medicare program. We're looking at it as a universal model, something that an employer and a provider, yes, Bruce, traditionally have been at loggerheads, but working a little bit more closely, and especially, as Kavita said, on the employer side, that you can take and modify it. So it's not just one size fits all. The basic model is there, but you can modify it, and we're starting to see that actually happen.
In your program at Columbia, are there any, do you know of any models in which large employers, regional employers are directly working with the university in this regard?
No, I don't.
We're seeing it in some markets. In Seattle, Boeing has done it where he's worked, bypassed the insurer and has working directly with Swedish regarding it. I don't know how many other examples there are. It's probably the largest example.
They're starting it, and you're going to see more. And literally, if you look at the National Business Group on Health survey from the fall of last year, you will see a basic dissatisfaction on the part of large employers with the status quo, with basically the insurers, with the PBMs, with literally the way. That's why they're taking a more active interest in healthcare. And look, cancer, as the population gets older, as the population gets more unhealthy, we see more incidents of cancer.